everybody, Dr. Daniel, and today I'll be talking about tips on how to sleep with migraine. Migraine is associated with depression and anxiety, both of which come with insomnia. Just plain old migraine alone comes with light sleep and not deep sleep. Poor sleep can set off more frequent migraine attacks, so sleeping well is a cardinal principle of treating migraines. How can a person with migraine learn to sleep well? Well, I have some suggestions. Number one, exercise. Persons with frequent headaches, such as chronic migraine, which is 15 headache days per month, 8 of which have migraine features, tend to not exercise because exercise generally makes migraine worse. On the other side of this, aerobic exercise can help both sleep and migraine. So migraine patients should exercise, and if jogging provokes a headache, then swimming or walking on a treadmill in an air-conditioned gym may be tolerated. Try to get some exercise. I never see persons who do manual labor who don't sleep well. Set your sleep cycle. Migraine patients should set their sleep cycle and be consistent. Jet lag is a real medical problem for persons who travel out of the country, like airline pilots. Many persons have 2 sleep cycles, one for the school or for work week, and then another one during the weekend, and this should be avoided. Staying up late on Saturday night and oversleeping Sunday morning may result in a weekend Sunday morning headache. Keep a migraine sleep diary. Keeping a sleep diary can be helpful for the patient and the doctor to study their patterns. Many cell phones report sleep patterns anyway, and there are migraine apps to track migraines, like iMigraine. Go to my webpage and see a list of migraine apps. The other thing that you can get is these new phones, wristwatches, which have sleep analysis on them. Take only short naps. Analyzing sleep for migraine means that long naps should be avoided. Many migraineurs wake up after a long 2-hour nap with a headache. It's true that all persons in all cultures get drowsy in the middle of their day, like Mexican siesta, and the drowsiness may be hard to resist. Yet many persons can dismiss the drowsy feeling with a short 10 to 15 minute nap, set with an alarm clock so you don't oversleep. Sleep and environment. The bedroom should be cool, quiet, preferably dog and cat free, and dark. Eye shades may help for bright rooms, and earplugs for house, road noise, or spousal snoring. Dim the room lights earlier when you finally go to sleep. Preparation for sleep. The person with migraine should prepare for sleep 30 to 60 minutes before lights out with no exercise and no TV. The blue light from the computer, iPad, or cell phone is stimulating. Emptying the bladder just before sleep and avoiding drinking fluids before rest may cut down on trips out of bed to the toilet. Learn CBT. The American Sleep Council recently advised all doctors to avoid writing a prescription for insomnia meds before suggesting that their patient learn cognitive behavioral therapy, either from a psychologist or YouTube. Enter CBT and insomnia into the YouTube search engine and watch one of the many short movies written by a specialist to help you sleep. CBT is a skill that may be learned whereby one replaces hurtful, worrying sentences in the head with a calming sentence. Instead of thinking what you should have done, congratulate yourself by noting how you tried. Think, not should I be perfect, but my peace of mind is worth more than trying to be perfect. Go see a psychologist to learn this, or learn it on YouTube. Warm milk. A low volume of high-calorie carbohydrate just for bedtime promotes sleep. I'm talking about something like the proverbial warm glass of milk. This has been studied scientifically and shown to work. You have to be careful here with the calories and the cholesterol. General. It's okay to get out of bed to go to another room for a while if you can't fall asleep when you first try. Then you may read, preferably something not too interesting, technical or work-related, for 10 or 15 minutes. However, watching TV or doing housework are not good options. They're too stimulating. Alcohol. Avoid alcohol or an evening nightcap. Alcohol is a short 2-hour lasting drug which may assist sleep at onset, but then it wears off, provoking awareness the rest of the night. medication. As a neurologist with a large headache practice, I try to avoid medicating sleep just as I have to, and the patient has tried and failed the ideas above it. So what do I use then? I mentioned that melatonin is over the counter and that doses of 3 to 12 milligrams at bedtime may be used. Also, Benadryl is an old-timey sedating antihistamine that's sold alone as Unison, or has been added to painkillers such as Tylenol PM, which is acetaminophen and Benadryl, and that may help sleep occasionally. Trazodone is supposedly the number one medication prescribed by doctors for insomnia, and trazodone is a generic of Desyrel, Desyrel, which is an older antidepressant. I heard the following statement at a psychiatry lecture on sleep years ago. Quote, trazodone, lousy antidepressant, great sleeping pill, end quote. I next go to amitriptyline, which is a generic of Elavil, an older antidepressant drug used for depression at 75 150 milligram with predictable side effects of dry mouth, constipation, and early morning drowsiness. But neurologists use amitriptyline in small doses, like 10 to 20 milligrams at bedtime. And here it's a mild migraine preventive drug, and it works well for sleep. I try to stay away from class 4 narcotics for sleep, and all the drugs listed so far are class 2 drugs and not addictive that I mentioned before. The FDA has approved Ambien, generic name is Zolpidem, which is a benzodiazepine drug like Xanax, and may be dosed at 5 to 10 milligrams for sleep. Okay, related questions. What about obstructive sleep apnea? OSA. Persons with possible obstructive sleep apnea may be obese with a thick neck and a small throat at the base of the tongue. They may have hypersomnia and fall asleep easily but inappropriately while driving, during meetings, at church or lectures or watching TV. At night, they may snore very loudly and also stop breathing, which is apnea, sometimes for over a minute or so. This syndrome can be suspected clinically but can only be diagnosed by a sleep study. Also, persons with OSA have higher rates of stroke, heart disease, and motor vehicle accidents than normal controls. Many persons who die in their sleep have OSA develop a malignant cardiac rhythm or nocturnal stroke and are found dead in the morning. OSA is a important diagnosis to make, and it's a risk factor for migraine. The spouses of a person with obstructive sleep apnea have interrupted sleep, and many spouses ultimately sleep separately until the one who has OSA is treated. Well, what about restless leg syndrome? Restless leg syndrome is diagnosed clinically with complaints of patients of trouble falling or maintaining sleep, and they may also have to get out of bed and walk or jiggle their legs under the cover. Leg movements helps the burning, aching, tingling pain, which is usually between ankles and knees, that keeps these patients awake, but which is temporarily helped by leg movement. A sleep study here may be normal or may show jerking or kicking of the legs at night, a syndrome called periodic leg movements. While all wired up during the EEG part of the sleep study, the patient may have myoclonic leg jerking. Some of these patients have low serum ferritin levels, Ferriti, and that's an iron level, and this test should be checked when the diagnosis is suspected. Sleep may be improved by treating with ferrous sulfate iron tablets, 325 milligrams, and checking the serum ferritin level. If it's less than 50, you should treat it. What about seeing a sleep specialist? Persons who don't respond to the above sleep medical analysis and treatment should be referred to a sleep specialist who will take a careful sleep history, analyze blood testing, and order a sleep study. Most persons who go this far with trying to treat sleep problems will find relief. Proverbs 3:24 says, "When you lie down, you will not be afraid. When you rest, your sleep will be peaceful." So, good migraine control and good sleep go together. So work on sleeping well. So it's the end of this talk today. Please check for my podcast on other subjects on migraine. I'll see you guys again at the next talk.